Hi, I'm Naomi from Academy of Fitness. I'm now going to take you through a static postural assessment. The purpose of doing a static postural screen is that it enables us to identify any postural deviations with our client. It also then enables us to identify the origin of the deviation and the degree of the deviation. If we do identify any postural deviations with our client, we can then determine whether these will be contraindicated to exercise. Remembering that a contraindication is anything that, if present, is potentially harmful to exercise. We can then also determine the effect of these postural deviations on our proposed exercise program, and then we can work out if this increases the risk of the exercise that we are wanting to prescribe. If we do identify postural deviations, as personal trainers, it is outside our scope of practice to undertake any form of rehabilitation training or programming. Therefore, if we do identify postural deviations, all we do is we simply fill out our form, we circle on the diagram where these deviations are occurring, and then we write a referral and we send our client off to the appropriate allied health professional. Today I'll be taking you through a static postural assessment using a plumb line made out of a piece of string, and you can use any piece of string. I would use something that is bright and easy to see. You can get it from Bunnings or any hardware store. All I've done is I've tied a small weight down the bottom of the string to keep it steady. You don't need to buy expensive equipment to do this static postural screen. Today we'll be looking at our client from 3 different angles. We'll be assessing our client's static posture from the anterior perspective, from the posterior perspective, and also from the lateral perspective. By doing this, it enables us to make sure that any postural deviations are identified. Okay, Kate, I'm going to do the static postural assessment on you now. The view I'm looking at is the anterior. I'll be looking at a number of landmarks on your body to try and line up the plumb line on the line of best fit. So I'm going to get you to move around a little bit while I get you in the right position. So can I just have you step a tiny bit to your right? Just do like a little shuffle over. Perfect, stop. Okay, just take 2 or 3 steps up and down. And I want you to start thinking about what you're going to be doing later today and try not, now step a tiny bit that way. Perfect. And try not to think about your posture as much as possible. Okay, so what I'll be doing is I'll be making some marks on my diagrams here, and I'll be identifying any deviations to what is considered normal posture. So what I've noted straight away is that your left shoulder is slightly elevated. So I'm just going to make a circle there, and you have a slight head tilt to the left-hand side. Down at the hips, knees and ankles, everything there looks normal. Over on the next page, what I am just going to make a note of is that the most likely reason why your left shoulder is slightly elevated is that your upper trapezius is overactive. It can also be that your levator scapula is overactive. And what we would see with that is that your left shoulder would elevate, and that you would also then potentially tilt your head to that side as well as the muscle shortens. So for that, we'll be stretching the upper traps and the levator scap, and the muscles that we're then going to try and strengthen are the lower trapezius. So the upper trapezius is up here and the lower trapezius down there. An exercise I will be giving you will be a seated row, and that will help correct that deviation. Okay, what I'm now going to ask you to do is to turn to your left and face the wall, or turn to your right, either way. Face the wall. Excellent. Keep going. Perfect. Okay, again, take a couple of steps up and down. Think about what you're going to be doing tonight. All right, and I'm just lining you up along the plumb line. I'm looking for landmarks around your ear, your shoulder, through your hip, knees and ankles. I'll get you to take a tiny step forward for me. Perfect. Okay, excellent. Again, just stay where you are. On this sheet, I am just going to make notes about any deviations that I see, and that is actually looking really great. Okay, what I'm going to get you to do is turn around and look in the other direction now. Facing that way. Perfect. Okay, a couple of steps up and down. Okay, I need you to shuffle a little bit further forward for me. Great. Okay. Wonderful. Okay, so again, I'm really happy with your posture in both lateral views. I'll get you to turn and put your back towards me, please. I'm now going to do the posterior assessment. All right, you need to take a little step to your left. Great. Okay, and what I'm seeing here again is that elevation of the left-hand side, which just confirms the anterior assessment that I did. Okay, all right, everything else looks great. All right, Kate, if you could just come over to me just for 1 minute. I'll give you some feedback. All right, at this stage you don't need a referral to an allied health professional. If at any time you start to experience pain in your neck or in your shoulder, then what we'll do is we'll refer you to a physio who'll be able to take a better look at what is going on there. I have indicated that we will be doing some stretching for the upper trapezius, and we're going to try and strengthen through the lower trapezius by incorporating a seated row into your program. Does that all make sense to you?
Yes.
Fantastic.